My name is Kirsten. I'm the nurse that's going to be assessing you today. How are you doing?
I'm good. You?
I'm doing well. So I'm going to cleanse my hands and pop on a pair of gloves, but while I'm doing that, I'm going to tell you that you do have a right to refuse. So if there's anything that you don't want me doing, just tell me. You also have a right to privacy and confidentiality. If there are certain parts that you don't want me uncovering, just let me know. Okay?
All right.
So let me pop these gloves on. So the first thing that I'm going to start with is I'm going to inspect your head and your face. So just looking here, without touching you, I can see that your face is symmetrical. I don't see any bruising. I don't see any abrasions, no scratches, anything like that. All right, so I'm going to touch your head. I'm palpating his scalp. I don't feel any nodules, any bumps, any abnormalities there. Are there any tender spots that I'm hitting?
No.
Okay, his hair is evenly distributed. So now I'm going to assess his temporal arteries. And they are 2+ bilaterally. And now I'm going to drop down and assess his temporal mandibular joint. Open and close your mouth for me. I don't hear any popping. I don't feel any cracking or creaking going on. Both sides are moving evenly. So now I want you to clench your teeth for me and open against resistance. Good. And now I'm going to take this cotton wisp and I'm going to drag it down the side of your face. Tell me when you feel it, okay?
Yeah.
Okay.
Yeah.
Okay. That is cranial nerve 5. So now I'm going to assess cranial nerve 7. So smile real big for me. Frown. Squint your eyes closed. Raise your eyebrows. Show me your teeth. And puff out your cheeks for me. Okay, so both sides of his face are moving symmetrically. So now I'm going to move on to his eyes. So if you'll stand up for me and stand right here. Now I want you to read this line here for me.
With both eyes.
Cover your left eye and read this line for me.
LPED.
Okay, the one below it.
PECFD.
Okay, try that one.
EDRCZP.
Okay. Now cover your right eye and start here for me again.
LPED.
The one below it.
PECFD.
The one below that.
EDFCZP.
Okay, so you are 20/40 in the left and 20/30 in the right, so sit down for me. Okay, so the next thing I'm going to do is I'm going to do the extraocular movements. So stare at my finger, don't move your head, and just follow my finger, okay? Okay, so his eyes are moving together and symmetrically. One is not lagging behind the other. So now I'm going to take my pen light and I'm going to shine it in your eyes, okay? Just stare straight ahead. His pupils are about 4 millimeters. They're equal, round, reactive to light. Follow my pen light in as I bring it towards your face. And his eyes are accommodating equally on both sides. So now can you take your glasses off for me? I'm going to palpate the external structures. So I'm palpating his eyebrows. I don't feel any nodules, any lumps. The hair is evenly distributed. I'm looking at his eyelashes. The hair is also evenly distributed. I don't see any discharge or any blood coming from anywhere. Open for me. His sclera is white. No discoloration noted there. The conjunctiva of both eyes are pink and moist. The irises are brown. I don't see any visible scratches in the cornea. The pupils are black and round. Okay, so now I'm going to take a look at your ears, okay? So I'm going to just feel on both sides. I don't see any visible discharge or blood. I don't feel any nodules on either side. Okay, so now I'm going to do the whisper test. I'm going to step behind you. I'm going to have you close one ear for me, and I'm going to whisper a word, and I want you to tell me what it is if you can, okay? Plug your left ear for me.
heard something, but I don't know what you said.
Okay. Plug your right ear for me.
I heard,
Soccer.
I don't know what you said.
Okay. That's okay. So you are hard of hearing, correct? And you do have a ringing in your ears.
Yes, and hearing aids.
And hearing aids. Okay. Alright, so now I'm going to take a look at your nose. So just looking at it here, I can tell that the bone is slightly off to one side. Your nose has been broken a couple of times, hasn't it?
Yep.
So I'm going to just palpate. I don't feel any, the only abnormality I feel is that the bone in his nose is crooked. I don't see any visible discharge or mucus. I don't see any blood anywhere. Okay, so I'm going to ask you to do the sniff test for me. So I want you to plug your left nostril and sniff in through your right. Okay, do the other one. A little bit cruddy, but able to get air in through both sides. Okay, so now I'm going to palpate your sinuses. So I'm going to start with the maxillary. I don't feel any swelling or anything here. Is that tender?
No.
Okay, and now I'm going to do the frontal. I don't feel any swelling here either. Is that tender?
No.
Okay. So now I'm going to move on to your mouth and your throat. So I'm just going to inspect. So just open your mouth for me. Okay, so the first thing I see is that the mucosa all over his mouth is pink and moist. He does have dentures. His bottom dentures aren't in, so I am able to really visualize his gums. I don't see any abrasions or any blood coming from there. Lift your tongue up for me. Underneath of his tongue, I don't see any abrasions or any open spots. The mucosa under there is also pink. Put your tongue back down. Tongue is pink. When I look at the top of his mouth, he does have his top dentures in, and they seem to be fitting well. The back of his throat is pink, moist. I don't see any redness. There are no tonsils to grade. His uvula is where it should be, and it appears to be fine. Okay, so now I'm going to use this tongue depressor, and I'm push your tongue out of the way, and I want you to say ah when I tell you to, okay? Ah. Okay, so his uvula is moving symmetrically. And now I'm going to test your gag reflex, okay? Yep, gag reflex is intact. So that is cranial nerve 9 and 10. Can you stick your tongue out for me? A little bit further. Okay, so the tongue is moving symmetrically on both sides. So that is cranial nerve 11. There's no problems there. So now I'm going to assess your neck. So the first thing I'm going to do is palpate your lymph nodes. So we're going to go preauricular, postauricular, occipital, superior cervical, tonsillar, submaxillary, submental, deep cervical chain, posterior cervical, and then supraclavicular. And then I didn't feel any lymph nodes there. There wasn't any spot that was tender, was it?
No.
Okay. So that is normal. So now I'm going to ask you to do some range of motion for me. So I want you to bring your chin to your chest. Tilt your head all the way back. Bring your left ear to your left shoulder. Bring your right ear to your right shoulder. Okay, sit your head back up straight. I want you to push against my hand. Okay. Push against this hand. Very good. Okay. Now I'm going to assess your trachea. So just looking here, I can see that your trachea is midline. I don't see any problems with that there. I'm going to palpate it gently. And I don't feel any deviations at all. So going here, I'm going to palpate your thyroid. So I'm going to step behind you. So I'm going to palpate right here for his thyroid. I can feel it. I can move it back and forth. It's not as spongy as it needs to be. You did have radiation therapy done on your neck, didn't you?
Yes.
Okay. Take a sip of that water for me. So Swallow. Okay, so the thyroid is moving up and down symmetrically when he swallows. Okay, so now I'm going to, I'll get that out of your way for you. And now I'm going to assess your carotid arteries.
Excuse me.
So it's 2+ on that side. And also 2+ on this side. So now I'm going to listen for a carotid bruit, okay? So I don't hear a bruit on the left. And I do not hear a bruit on the right. Alright, so now I'm going to ask you to pull your shirt off for me, and then turn around and face the wall. And sit down. Okay, so the first thing I'm going to do is I'm just going to inspect. His chest is symmetrical on both sides. I don't visualize any abrasions, any bruising, no rashes. So now I'm just going to palpate down and see if I feel any nodules, anything like that. Are there any tender spots that I may be hitting?
No.
Okay. So now I'm going to test tactile fremitus. So I'm going to put my hands on your back and I'm going to tell you to say 99, okay? All right.
99. 99. 99. 99.
Okay, so I don't feel any consolidation there. Both sides of his chest are symmetrical. So now I'm going to percuss the posterior lung fields. Okay, and I didn't hear anything weird there. They're all real resonant sounding like they should be. So now I'm going to percuss the costovertebral angle for flank tenderness. So I'm going to hit you right here and you tell me whether or not you're tender, okay?
No.
Okay. Okay. So no tenderness there. So I'm going to now listen to your breath sounds, okay? Take a deep breath in for me. In. In. Out. In. Out. In. In. Okay. So all of his breath sounds are equal and clear in all lobes. So now I'm going to have you turn back around for me. Let me get some of this out of the way. So now I'm just going to inspect your upper extremities. So I'm just going to inspect here and palpate as I go down. So I don't feel any swelling, I don't feel any nodules, I don't feel any abnormal lumps. So now I'm going to assess pulses. So I'm going to do brachial, 2+ on both sides, radial, 2+ on both sides, ulnar is 2+ on both sides. So now I'm going to ask you to do some range of motion for me. So I want you to extend your arms over your head, hyperflex them behind your back like this. Okay, now bring them both to your sides and raise them both up for me like this. Okay, good. Now I'm going to do some range of motion on your elbows, so I want you to flex for me, extend, flex against resistance, extend against resistance. Okay, good. Now I want you to start like this. Pronate. Supinate. There we go. Okay, now range of motion of the wrist. I want you to flex your wrists back. Extend them down. Now I want you to make a fist for me. Extend your fingers. Now I want you to take your thumb and I want you to touch it to each one of your fingers. Very good. Okay. Now we're going to do a cerebellum test, so the finger to nose test. So I want you to take your finger and place it to your nose like this, okay? Very good. Now, I'm going to test your reflexes now in the upper extremities. So I'm going to, let me see your arm, hang it out like this, and just relax. Okay, stays a little bit. And just relax for me. So that was tricep, this is bicep reflex. And his bicep is twitching as well as his forearm. So now I'm going to go to radial. Relax for me. And he is getting a little bit of a jump right there in his hand. So now I'm going to test it on this side as well. Relax for me. Okay. So that is even with the other side. I'm going to test brachial again. Relax. Pop your hand up a little bit against me if you have to. So his bicep muscle is jumping when I hit right there, and so is his forearm. So that is 2+ as well on this side. And now radial. And his hand is also jumping. So they are equal bilaterally on both sides. So now, while I'm still here, I'm going to assess capillary refill by looking at his fingers. Capillary refill is less than 2 seconds in both hands. So now, I'm going to test for graphesthesia. So I want you to hold your palms up for me. Close your eyes. I'm going to draw a number in the palm of your hand, and I want you to tell me what it is, okay?
7,
Yes.
3,
Yes. Keep your eyes closed, keep your palms up. Now I'm going to test for stereognosis. So I'm going to place a common object in the palm of your hand, okay, and I want you to tell me what it is.
clothespin,
Yes.
pencil,
Yes. All right, you can open your eyes for me, put your hands back down. All right. So now if you can just lay down for me. All right, so I'm going to inspect the anterior chest. Just looking at it here, his work of breathing is non-labored. I do see that he does have a previous surgical incision right here. But other than that, just visualizing, I can't see any other abnormalities. So I'm going to palpate and be sure that I don't feel any nodules or anything like that. Are there any tender spots that I'm hitting with my hand?
no,
Okay. So now, I'm going to listen to heart sounds. So I'm going to listen to aortic, pulmonic, tricuspid, and mitral areas. First, with the diaphragm on my stethoscope. So aortic. Pulmonic. Tricuspid. And mitral. So all I hear is S1 and S2 sounds in all 4 of those. So I'm going to turn and use the bell of my stethoscope now to listen for any bruits in those areas. So again, aortic, pulmonic, tricuspid, and mitral. Okay, and I didn't hear any bruits in any of those areas. So if you can just stay lying down for me. Now I'm going to assess his abdomen. So just upon inspection, I do see that he has an previous abdominal incision running right here, as well as here, a previous ileostomy site, and a previous feeding tube site. So now I'm going to just auscultate for vowel sounds in all 4 quadrants. We have normal active vowel sounds in all 4 quadrants. So now I'm going to percuss in all 4 quadrants. So I'm going to just have my fingers laying on your stomach and I'm going to tap my fingers with my reflex hammer. And listen. Okay, so I was able to hear when I got into this second quadrant here that it is more tympanic. His liver is here. His liver has been cut on, so it's a little bit displaced. And he also has had a bowel surgery, so in some places his abdomen is not as resonant because he is missing about half of his bowels. So now I'm just going to palpate. I'm going to start light, and I'm going to go deep, and I want you to tell me if you feel anything tender, okay? Palpating here. I can feel his liver a little bit, and I'm going to push a little bit deeper. It's smooth. I don't feel any nodules or lumps right there on his liver. And I don't feel anything abnormal in any of the other quadrants. There were no tender spots that I ran into. Alright, so now I'm going to assess your lower extremities, so I will be taking your socks off. So just inspecting the lower extremities from here, I don't see any visible swelling. I can see that he does have some varicose veins around his ankles. So I'm going to just start on one leg and the other. I don't feel any swelling. I don't feel any nodules. I don't feel any tender spots. Are there any tender spots?
On the top of my feet.
Top of your feet?
Yeah, right there, but not normal. I mean, it's not abnormal.
Okay. Alright. So now I'm going to assess pulses. So I'm going to start with the popliteal pulses. And they are 2+ bilaterally. I'm going to go tibial pulses are 2+ bilaterally. Dorsalis pedis, it is 2+ in the left leg, 1+ in the right. Okay. So now I'm going to have you do a little bit of range of motion for me. So take this right leg and raise it up 90 degrees for me. Alright, put it down. Now do the same with your left. Okay. Take this right leg. I want you to bring your knee to your chest. Very good. Put it down. Do it with your left. Very good. Now I want you to take your right leg. I want you to swing it out towards me. And take it back for me. Alright, now do the same thing with the left. There we go. Now, I'm going to do some range of motion on your feet, so I want you to dorsiflex for me. So pull your toes up towards you. There you go. Now plantar flex. Point your toes toward me. Now dorsiflex against resistance. Good. And plantar flex against resistance. Very good. Okay. So now, I am going to do the lower extremity reflexes. So while I have you laying like this, the first thing I'm going to do is the Babinski reflex, since your feet are already up here for me. So I'm just going to drag the end of this up the bottom of your foot to test to see if your toes fan out, okay?
Crap.
Okay, I'm sorry. His toes did curl under there, so they didn't fan out. And they did curl under there as well. So we have a negative Babinski reflex. So now I'm going to check the Achilles. So just relax. I'm going to lift your foot up. And when I do hit, his foot is jerking, so that is a 2+ reaction there. On the right. And now let me get to the left. And there is a reaction there as well. So now if you could just sit up for me and hang your legs off the bed, don't let your feet touch the floor. So now I'm going to test the patellar reflexes. So that is 2+ on the left. And 2+ on the right as well.
That is so weird.
Now, can you take your left heel and drag it up your right calf for me? Okay, very good. Now drag the right heel up the left calf. Thank you. Now if you could stand up for me. Now if you would just walk across the floor to that chair on your heels for me. Alright, now turn around and walk back to the bed on your toes. Okay, now continue to stand for me. I want you to hop on your left leg, just on one leg. Now do the other one. There we go. Now I want you to bend over for me, just let your arms hang. So I am palpating his spine and looking at it. I don't see any abnormal curvatures or anything like that. I don't feel any abnormal lumps or anything to that extent. Okay, can you bend over and try to touch your toes for me?
That's
Now,
about it.
alright, bend over backwards. Now can you bend over to your right? Now to your left. Okay, now I need you to do the Romberg exercise for me. So I want you to stand with your feet together. Close your eyes, relax, and just stand there for a minute. Okay, very good. You can open your eyes. A little bit of wiggling is normal, so he's not like drastically swaying back and forth. Okay. So now the last thing I want you to do is just take your shoulders and turn them side to side for me. Very good. Alright, now you can sit back down. You can put your shirt back on if you'd like to. So I looked through your history and I did see that you do have, currently, you're being treated for hypertension. So I had a little pamphlet made explaining to you what about hypertension. Or high blood pressure. So we do call it hypertension. You may see it abbreviated as HTN. So that a normal blood pressure is typically approximately 120/80. Typically, depending on which doctor you go to, you may not get diagnosed with hypertension until your blood pressure is 140/90 or higher. So typically, most people don't know that they have it until they go to the doctor and they get their blood pressure taken. And their doctor says, oh, well, you do have hypertension. So approximately 47% of adults in the United States have hypertension and don't know about it. Which is a problem because long-term hypertension can cause a lot of problems such as strokes, increased risk of heart disease, it can damage your kidneys, it puts you at greater risk of developing dementia later in life. And it can also affect your eyesight. It can cause a lot of pressure. So something we want to do is when you are diagnosed with hypertension, diet changes is typically one of the first things we're going to go with, and exercise. So we want you to get a moderate amount of exercise every week, so 150 minutes, so 30 minutes 5 times a week. It doesn't have to be anything strenuous. You don't have to go out and try to run as far as you can, as fast as you can. Just try maybe a brisk walk for a mile just to get you started. Also, diet changes. We want to try to stay away from processed foods that have a lot of added salts and sugars and things like that. We also want to watch how much salt we are putting in food because that increased salt intake can increase your blood pressure. So Something else that you may end up taking, like you are now, is a medication like a beta blocker or an ACE inhibitor, which you are currently taking amlodipine, which is helping keep your hypertension under control. So, of course, we want to try to use things like diet and exercise first, unless your blood pressure is way too high. So we may end up using a combination of diet, exercise, and medication to keep your blood pressure lower. So do you have any questions for me?
No.
All right.